So the next thing we'll talk about are the routes of administration. Very, very important concept. You need to know the routes of administration. So you need to know, when we're talking about routes of administration, a route is referring to the path through which the dosage form, the drug, or the medicine enters the body, right? Where that is what we're referring to as an administration route. So there are two types of administration routes. The first type, we have local routes. So when we say a local route is a route of administration that exerts its action locally, like on the same area you apply, that's where the action will be exerted. And then we also have systemic routes. So for systemic routes, they somehow have to make their way to systemic circulation first before they exert their action. So those are our two administration routes. So let's talk about the local routes. So when we talk about the local routes of administration, think of this mnemonic TL, right? But then the key thing, remember that there are two T's, there are three I's, and there are two O's. So TL, right? So the first T stands for topical administration route. When we say topical administration route, it's exactly what you're thinking. So we're talking about applying on the surface, usually on an epithelial surface like the skin. An example would be sunscreen, gels, lotions, and ointments, right? The other T is for transdermal administration. A very good example is the nicotine patch. So the nicotine patch is a patch that you usually put on your shoulder, and then after you put it on your shoulder, the drug, in this case nicotine, will be administered locally on your arm over an extended period of time. And then the I is for inhalation. So when we talk about inhalation, we're talking about aerosolized meds. When you think about this category, think of an asthma inhaler. And then intradermal administration, think of an allergy test. I think an allergy test is a very good example. Before we can administer certain drugs, like there are some people who are allergic to drugs like let's say penicillins or so. So what you can do is that a small amount of that drug can be administered intradermally, and then you observe the reaction. If the particular individual has a reaction, what do? You discontinue the drug, you don't use the drug. And then intranasal administration. So intranasal is directly into the nose, right? That's also local. And then ophthalmic administration, we're referring to administration into the eye. So we have eye drops, eye ointments. Otic administration, this is referring to the administration route directed towards the ears. So we have ear drops here. Let's talk about systemic routes. Like we said before, systemic routes are routes that have to make their way into systemic circulation. So there are generally two types of systemic routes. We have entero, and then we also have parenteral. So when we talk about entero routes, these are routes that are associated with the gastrointestinal system. So they go through the GIT. So if you want to remember these routes, all you need to do is just say bros, right? Think of your bro. Yeah, so the B is for buccal, the R is for rectal, the O is for oral, and then the S is for sublingual. So what does buccal mean? Buccal means into the buccal cavity, which is like the cheek or the inside, the wall of the inner mouth, right? That's the buccal cavity. Then rectal means administering into the rectum, and then oral means administering into the mouth, and then sublingual, usually that means under the tongue. And then when we talk about parenteral routes, these ones are not through the GIT. Usually they are injections. So if you want to remember these ones, please keep note of these mnemonics, because these mnemonics could save your life. Yeah, so the parenteral routes, think of this mnemonic VOTMAP. So VOTMAP, just know they'll all start or begin with an intra. So we're saying the V is for intravenous, the O is for intraosseous, the T intrathecal, then we have intramuscular, intraarticular, and intraperitoneal. intraperitoneal. So when we say intravenous, we mean inside the vein. Intraosseous, inside the bone. Intrathecal, cerebral, spinal fluid. Intramuscular, inside muscle tissue, right? And then intra-articular, also in an injection in the synovial fluid or of the joints, right? Intraperitoneal, injection usually in the peritoneal cavity. Yes, so make sure you go through this one because this one is an important one. While we see a route of administration, see some of the advantages and disadvantages. So the first one we have here is topical. So when we said topical route, what are some of the advantages? There is no first pass effect. So what does first pass effect mean? So first pass effect refers to a reduction, let me say, in the bioavailability of a particular drug due to hepatic interference. So what do I mean? What I mean is that normally, whenever you have a drug, you want that drug to enter systemic circulation. So if you take that drug, usually orally, what happens is that once that drug absorbs and enters, let's say it absorbs in the intestines, what happens next is that before it enters systemic circulation, it first passes the liver. And then when it passes the liver can deactivate or can biotransform some of that drug. And then that concept is called first pass effect, because once that drug is biotransformed, the effective drug that will reach systemic circulation will be less. Like suppose you administered 100 micrograms of, let's say, penicillin or something, right? Let's say it was orally administered. You end up seeing that a very small portion of that amount of drug will reach systemic circulation. Maybe you might just have, I don't know, maybe like 400 milligrams, meaning 600 milligrams was changed or biotransformed by the liver. We refer to that as first pass effect. So that's the first advantage. So there's no first pass effect, because first pass effect is generally associated with oral administration. Second, less or no systemic side effects. This one is very true. You won't have too many side effects. The disadvantage, usually they have no specific dose. We see this a lot whenever you're applying a cream or an ointment on your skin. There's no dose you can apply. There is no specific dose or amount that you can apply. And then the drug must be potent. This one is not really a strong disadvantage, but this one is true. If you're applying a drug locally, one thing that needs to happen is that the drug must be potent, because if it wasn't potent, you would have to apply a lot of drug for you to achieve the particular action. Then let's look at the oral route. First advantage, convenient to use. It's very easy to use. Two, patients usually prefer this route, so you get a lot of patient compliance when you're using the oral route. Relatively cheap. So when we say cheap, we're referring to the fact that the tablets or the capsules are usually cheap, yes, but we're also referring to the fact that it does not require a trained professional. Anyone can use the oral route. It's as simple as just putting the tablet in your mouth. For that reason, it also contributes to the idea that it is cheap, because if you had a trained professional administer the drug orally, then you would have to pay that professional. So that's the point I'm trying to get at. So it's cheap. And then no skill is required. Anyone can do it. It doesn't take a genius. And then it's non-invasive. You don't need to penetrate the skin or penetrate anything. And then it is reversible. In case of a mistake, or in case someone was trying to commit suicide, you can give them drugs like emetine, and then they'll be able to vomit out the drugs. Then let's look at some of the disadvantages. One, if you're using the oral route, you have first pass effect. We discussed what this one is, because the liver will be able to biotransform some of that drug, and then you won't have enough drug in the systemic circulation. Two, it's not suitable for unconscious or vomiting patients. If a patient is vomiting or unconscious, there is no way you will shove a tablet or a capsule in their mouth, right? It's not suitable when a patient has dysphagia. So what does dysphagia mean? Dysphagia simply means difficulty in swallowing, and then may have unpleasant taste. This is true for some drugs. It may irritate the mucosa, usually the gastric mucosa, yeah, though not all drugs. And then we'll be able to see that the dosage form usually can prevent this. And when we look at the sublingual route, sublingual one, there is rapid absorption, true. Drug stability is preserved because there is less interaction with enzymes and acid. This is very true. Can't compare with the oral route where the drug has to go against acid, has to go against enzymes, right? And then convenient if the patient has dysphagia, yes, because there's no swallowing involved. All they have to do is let it sit at the bottom of their mouth, and then it will directly dissolve. It will directly enter systemic circulation. And then disadvantages: one, must be kept in the mouth for some time. This is usually not ideal, especially if it has an unpleasant taste. Two, it cannot be used. So it cannot be used if a large dose is to be administered. This is true because there's a limited capacity or limited space in the mouth. And then unpleasant tastes at times, yeah, that's a good disadvantage. And then when we look at BACO, one, rapid absorption. Two, drug stability is preserved because there is less interaction with enzymes and acids. True. Convenient if the patient has dysphagia. This is also true. Cannot be used if a large dose is to be administered. Unpleasant taste at times. Must be kept in the mouth for some time. Same as sublingual. And then rectal. Rectal, one, it's suitable for unconscious or vomiting patients. This is true. Because the patient was unconscious or vomiting, you could, if you administered rectally, that would not really affect anything. Two, suitable when the patient has dysphagia. That's true. Rapid absorption, yes. Local action, if you want to target especially the rectal area, right? If you use the rectal route, it has local action. No first pass effect. Drug stability is preserved because there is less interaction with enzymes. Yes, useful in pediatric patients. When we say pediatric patients, we're referring to young ones, right? And then it may irritate the mucosa. Yes, uncomfortable. This is true because it melts, and then there's that slipperiness. There's that slippery feel. And then low patient compliance. Usually patients don't want to have drugs inserted in their rectum, right? And then potential for leakage. This one is also true. Sometimes it could leak. Whenever it dissolves, some of that fluid could leak and wet your clothes. And then the drug may be removed when passing stool, right? Affecting its plasma concentration or something. And then the IV route. This one, you need to remember this one. So it's the only administration route with 100% bioavailability, one. So it's suitable for unconscious or vomiting patients. Yes, this is true. Suitable when a patient has dysphagia. Very true. Very quick onset because it has 100% bioavailability, right? And then, okay, just in case you don't know, bioavailability refers to the fraction of unchanged drug that enters systemic circulation. So this is why it's 100%, because you've already injected inside the systemic circulation. You've already injected it in the vein, and then it has entered systemic circulation. No first pass effect. Drug stability preserved because there is less interaction with enzymes and acid. That's also true. Some of the disadvantages: expensive. Yes, generally it's more expensive than oral. Skill is required. You need to have skill for you to inject someone. And then it's invasive. Yes. Non-reversible. Yeah, if you make a mistake, you cannot undo the injection, right? And then there's a risk of infection. Yes, this is generally seen whenever you do not sterilize properly, right? And then increased systemic side effects. Intramuscular route, high bioavailability. It's not 100%, but it's quite high. Suitable for unconscious or vomiting patients. It's suitable when a patient has dysphagia. Suitable for fat-soluble drugs. This one is a very important one. When you inject intramuscularly, what happens is that the fat-soluble drugs form a depot, and that depot can have extended release. It can be released over a long period of time. So what are we saying? That the drug stability is preserved because there is less interaction with enzymes and acids. Yes, no first pass effect, and you can have sustained release. Disadvantages: expensive. Yes. Skill is required. Yes, it's invasive. It's non-reversible. Risk of infection. Poorly, especially when you poorly sterilize. Slow onset of action as compared to intravenous. Let's talk about intraosseous. So when we talk about intraosseous administration, you'll be able to see that one, easy access when intravenous access is challenging. Yes, this one is true. Effective and direct absorption. Yes, because you are injecting directly into the bone. Useful in emergency settings. Yes, it's quite quick, has a quick onset. And then limited volume or capacity in the bone marrow. Yes, the bone marrow can only hold so much. And then risk of infection, true, especially if you don't sterilize enough. Skill is required. Potential for complications like extravasation or damage to extraosseous tissue, right? Yeah, so intrathecal, when we talk about intrathecal, we mean directly into the cerebral spinal fluid. So advantages: one, direct CNS access. There is no need to cross the blood-brain barrier. We know that there are 3 places where drugs should not go in normal particular cases, right? There are 3 places where drugs should not go. 1, the blood-brain barrier. 2, the testicular barrier. And then 3, the placental barrier, right? And then only highly lipophilic drugs can go to those places. But when you inject intrathecally, what happens is that you do not need to have a highly lipophilic drug, right? It directly reaches the central nervous system. Another advantage: low systemic side effects. True, because you've injected it directly, right? And then it's good for neurological disorders. That's true. Then disadvantages: invasive, risk of infection, limited volume, skill is required, it's quite expensive. Intraarticular, direct action to the joint, less systemic side effects, no first pass effect. Yeah. So disadvantages: risk of infection, skill is required, it's expensive, limited volume. Intraperitoneal, less systemic side effects. Yes, no first pass effect. There is local action, large surface area for drug absorption. Disadvantages: risk of infection, skill is required, expensive. Those are pretty much the routes that you need to know. The last part now, we'll talk about the rights of a pharmacist. Very, very important concept. You need to be able to memorize these 6 rights. So firstly, we have the right patient or client, of the right cost, of the right drug. That should spell right drug. Yeah, that right drug, right route, right dose, right duration or time. So for this one, you don't necessarily need a mnemonic. You just need to think of this simple statement or this simple sentence. We're saying, just think about this. So you think of the sequence of events whenever you're attending to a patient, right? You think of the sequence of events. What's going on here? Yeah, so what do? You think of the sequence of events when attending to a patient. So what are we saying? We're saying attend to the right patient and dispense the right drug at the right cost, through the right route, at the right dose, and at the right time. I know that can sound a bit cumbersome, but just think of it like this. Firstly, you think about the patient, right? We're saying make sure you always attend to the right patient. And then once you attend to the right patient or client, you need to be able to dispense the drug at the right cost. Very important. You do not add anything. You do not subtract anything. You dispense at the right cost. This can also extend to issues where you look at economic status, for example. If a person is not able to afford a particular drug, right, you do not think in terms of profits as a pharmacist. Instead, you are thinking of your care should be patient-centered. What we're trying to say is that at the end of the day, if a particular individual cannot be able to afford a particular medication, for example, what do you do? What you do is you be able to swap it out with another medication of the same efficacy, right? That's another thing to take note of. Then 3, you give the right drug. Of course, you need to make sure you give that drug through the right route. You know, there are drugs which are meant for oral administration. There are drugs meant for IV. There are drugs meant for intramuscular. You need to be able to give through the right route. And then you give the right dose. Very important, because if you give too much of the drug, it can have toxic effects. If you give too less, what can happen is that it cannot elicit the particular action. And then also for the right duration. So that will end our video. Be able to see you in the next one.